Good afternoon. Welcome back after lunch to our June 16th NVAC meeting. Our next presentations are our federal agency updates. I will run through them by agency. We have some presentations that will be given. Others I will note where we've got written updates that are available to the committee. AHRQ has provided a written update. I understand they're not going to be providing a verbal update today. Is there a presentation from BARDA?
Hi, this is Christine from BARDA. I'm on the Zoom link. I don't have a presentation, but I wanted to give you a couple updates that you all can find in the written portion of the update that was provided to the committee members. But I wanted to point out that we continue close coordination and collaboration with industry and interagency partners to support the federal COVID-19 response for vaccines. And these efforts include supporting the advanced development and ongoing manufacture and procurement of COVID-19 vaccines. Switching gears a little bit to the Ebola side, there is ongoing clinical development of Merck's Ebola vaccine, Ervebo, and data is being generated in pediatric subjects and HIV-positive subjects that might enable expansion of the label indication to include those populations. BARDA entered into an agreement with Merck to procure doses of this vaccine, and BARDA is also coordinating very closely with the WHO, with Gavi and UNICEF on the global supply of Ebola vaccines. And we heard a nice presentation earlier today. Back in May, just last month, we've seen an outbreak of monkeypox disease. And as you know, Bavarian Nordic's Jynneos vaccine is being used as part of this response. As you know, the Jynneos vaccine is a live, non-replicating vaccine for the prevention of smallpox and monkeypox disease in adults 18 years of age and older determined to be at high risk for smallpox or monkeypox infection. So this product was supported by BARDA and other federal agencies through licensure and is the only currently FDA-approved vaccine for the prevention of monkeypox disease. So last month in May and earlier this month in June, options were exercised on existing contracts to fill bulk drug substance. And again, switching gears to pandemic influenza vaccine. As you know, since 2005, BARDA has maintained contracts with the licensed influenza virus vaccine manufacturers under a medical countermeasures for pandemic flu and emerging diseases preparedness response program. And one major component of this program is the U.S. National Pre-Pandemic Influenza Vaccine Stockpile. And this allows a quick response at commercial scale because the contracts are already in place in the event of a pandemic. It also allows for continuous updates of pre-pandemic vaccines and adjuvants that are stockpiled for pandemic preparedness. And just for the update for this group, this program was successfully recompeted and contracts were awarded to 3 companies in late February 2022. And those companies were to GSK, Sanofi, and to Seqirus. And finally, BARDA continues its projects for anthrax, Zika, pandemic flu, and needle-free vaccine delivery systems. And all of these details in a little bit greater detail can be found in the written update that was provided. And I'll go ahead and stop there from BARDA. Thank you.
Thank you, Christine. Our next presentation is from CDC.
Good afternoon. We did provide written comments, so I will just make a couple of very brief verbal remarks. We're very delighted that Dr. Jose Romero has started at CDC as the new director of CDC's National Center for Immunization and Respiratory Diseases. I expect many of you know Dr. Romero from his previous service as Secretary of Health for the state of Arkansas, and he also was a previous chair of the Advisory Committee on Immunization Practices, as well as FDA's Vaccines and Related Biological Products Advisory Committee. An additional personnel announcement is that Dr. Georgina Peacock has been named Director of CDC's Immunization Services Division. I also wanted to supplement the information in the written update about anticipated ACIP meetings with FDA's advisory committee advisory committee meeting the previous 2 days. We have scheduled a meeting of the advisory committee on immunization practices tomorrow and Saturday. That's July 17th and 18th, where should there be authorized products, we anticipate that ACIP will be discussing use of the Moderna COVID-19 vaccine for 6-month to 5-year-olds and the Pfizer COVID-19 vaccine for 6-month through 4-year-olds. We will take up, again, contingent upon there being regulatory action by FDA, discussion of the use of the Moderna vaccine in older children 6 to 17 years of age at our regularly scheduled meeting the following week on June 22nd and 23rd. And that concludes my comments.
Thank you very much, Melinda. Our next presentation from DOD.
Good afternoon. This is Bruce McClenathan with the Defense Health Agency Immunization Healthcare Division, representing DOD. As it relates to COVID-19 efforts, the Department of Defense COVID-19 vaccine implementation plan encompasses active duty, U.S. Coast Guard, Reserve, National Guard personnel, in addition to retirees, beneficiaries, and additional individuals authorized to receive COVID vaccine from the Department of Defense. As of May 16th, 2022, the Department of Defense has administered over 8.2 million FDA-approved, authorized COVID-19 vaccines at approximately 400 immunization sites globally to those with an indication based upon age, medical history, in accordance with FDA guidance and CDC recommendations. DoD captures adverse events on its beneficiary populations through the CDC's Vaccine Adverse Event Reporting System or through the DHA Immunization Healthcare Division's 24/7, 365 immunization-related clinical call center. The Defense Health Agency Immunization Healthcare Division will submit VAERS reports on behalf of those who contact our call center if not previously submitted. Furthermore, the Defense Health Agency Immunization Healthcare Division is also engaged with CDC's Vaccine Safety Technical Work Group, or VAST. Similar to other attendees, the DoD is following June FDA discussions on the Novavax vaccine, as well as vaccines for those 6 months of age and older, and whether new formulations of COVID-19 vaccine will be recommended in addition to the timelines of availability and subsequent ACIP meetings. As it relates to monkeypox, DoD is engaged in following several reports of monkeypox in multiple global locations. And finally, our efforts with Southern Hemisphere influenza vaccine. DoD continues its annual Southern Hemisphere influenza vaccine program for those with an indication. Administration of Southern Hemisphere or Northern Hemisphere influenza vaccine is separated by at least 30 days from any previous dose of influenza vaccine. Thank you.
Thank you very much. FDA.
Hi, this is Jay Slater. I'm the Director of the Division of Bacterial, Parasitic, and Allergenic Products in the Office of Vaccines. We did submit a written summary, so I'm just going to summarize it very, very briefly, plus add something that we left out. The item that we left out is that on June 3rd of this year, FDA approved Priorix, which is a vaccine for active immunization for the prevention of measles, mumps, and rubella in individuals 12 months of age and older. This can be according to the conventional schedule of the first dose, 12 to 15 months, and the second dose at 4 to 6 years. Although if it's not being administered according to the conventional 2-dose regimen, it can be given a minimum of 4 weeks apart in other individuals. All the rest of our activities that are reportable relate to COVID-19 vaccines. There were a number of actions that the agency took in the last 6 or 7 months that involved either expanding or contracting or otherwise modifying the emergency use authorizations for the Janssen COVID-19 vaccine, the Moderna COVID-19 vaccine, and the Pfizer-BioNTech COVID-19 vaccines. On 31 January, FDA approved Spikevax. This is the Moderna product for the prevention of COVID-19 COVID-19 disease in individuals 18 years of age and older. Spikevax is the same formulation as the EUA Moderna COVID-19 vaccine. and is administered as a primary series of 2 doses, 1 month apart. As you're all very aware, this has been a very busy month in terms of VRBPAC meetings. We have had 3 so far on June 7th, June 14th, and June 15th to discuss the COVID-19 vaccine manufactured by Novavax, as well as to discuss the pediatric and infant indications for the EUAs of Moderna and the Pfizer-BioNTech products. On 28th of January, the VRBPAC will be meeting again to discuss whether the SARS-CoV-2 strain composition of COVID-19 vaccine should be modified, and if so, which strains should be selected for the fall of 2022. And that's my report.
Thank you, Jake. Clarify that was the 28th of June, not January. Is that correct? For the strain, 28th of June.
Is the upcoming VRBPAC
Yes.
meeting.
Yes.
That is correct. I'm sorry.
Great. Thank you. Next is Indian Health Service.
Good afternoon, everyone. This is Uzma Chukuma. I am the Infectious Disease Branch Chief within the Office of Public Health Support. Thank you for giving me the opportunity to share the IHS Indian Health Service IHS update on immunization. We submitted a full report, but would like to highlight a few activities. The Indian Health Service continues to confront the SARS-CoV-2 pandemic and its impact on population health and routine immunization efforts. The IHS COVID-19 vaccine task force is preparing for the distribution and administration of the COVID-19 vaccine to the tender age group of children who are less than 5 years old. The IHS is working with the HHS coordination, operations, and response element and the CDC as well to estimate the less than 5-year-old IHS population to ensure the IHS has the appropriate allotment of vaccines for federal, tribal, and other facilities that choose to receive their vaccine through the IHS. In support of maximizing COVID-19 vaccine coverage rates and effective administration of the vaccine, especially among the most vulnerable members of the tribal communities and the tender age group, the vaccine task force continues to outreach and share COVID-19 product information, anticipated authorization, as well as communications on pre-ordering timeframes and anticipated regulatory timeline for the tender age vaccines. The IHS continues ongoing communication and messaging to tribal, federal, and urban organization partners regarding regulatory and clinical changes, including new recommendations for boosters for the 5 to 11-year-old cohort, as well as the second booster for the specialty population and elders. The IHS is preparing the ITU for Pfizer-BioNTech ordering and distribution, including developing tools to assist decision-making. Ongoing information and update of COVID-19 vaccine competency exams for providers, such as updating existing competencies with new information on shelf life extension continues. The IHS routinely collaborates with the CDC and engages with tribal leaders to support vaccine confidence among the American Indian and Alaskan Native Service population. The IHS immunization program leveraged COVID-19 vaccination strategies to efficiently implement new expanded ACIP eligibility recommendations within our service population for adult pneumococcal vaccine, zoster, as well as the hepatitis B vaccine. The immunization program developed a resource and clinical guidance document and conducted training to support implementing pneumococcal and zoster recommendation in the field. Additionally, the immunization program is working on modifying the IHS National Government Performance and Results Act, GIPR adult commuter immunization measure to align with the ACIP recommendation for pneumococcal conjugate vaccine, PCV 15 and PCV 20, and the HEDIS adult immunization status. This ends my presentation. Thank you.
Thank you very much. I understand USDA has a written update that has been shared. Is there a presentation from VA? Not hearing Troy on the line, there's a written update that's been provided. Are there any additional federal agency updates? Any questions or comments from those on the committee, either in the room or online? All right, thank you all for your updates. We will now move on to our liaison representative updates. We'll start with AHIP.
Hi, this is Devin Plote as a representative from AHIP. So we provided written comments, but I'll summarize those. Health insurance providers have continued working to support access to COVID-19 vaccines as the country continues to fight against the COVID-19 pandemic. During the initial rollout of the COVID-19 vaccine, insurance providers helped vaccinate more than 2 million seniors in vulnerable communities in 100 days through the Vaccine Community Connectors program. AHIP and its members have continued to provide access to primary doses and booster doses for eligible populations and work with provider and community partners to bring vaccines to newly eligible groups based on recommendations from CDC's ACIP. In addition to our work around COVID-19 vaccines, health insurance providers have also been reemphasizing the importance of routine vaccinations, especially as recent reports have shown that rates of recommended vaccinations among children entering kindergarten have fallen, leaving hundreds of thousands of young people vulnerable to vaccine-preventable diseases. To address these shortcomings, health insurance providers are taking proactive actions to help connect individuals and families to needed vaccines. These include strategies like utilizing claims data to identify which children have not received recommended vaccines and encouraging families and parents to schedule an appointment, as well as working directly with providers to improve vaccination education and rates among their patients, and prioritizing outreach to parents and guardians to provide fact-based information about the importance and value of childhood vaccines. We're also working with community partners and providers to establish community clinics for vaccines, create vaccine-specific office hours within pediatrician offices, and collaborate to disseminate culturally competent information to dispel misinformation about vaccines. We look forward to continuing to collaborate with multiple partners to keep Americans healthy. Thank you.
Thank you, Devin. Next is AIM.
Thank you. This is Claire Hannon from AIM. We provided an extensive written update for anyone who's interested, but I'll just highlight a few things. We're really happy to be having our Leadership in Action conference that we haven't had the last 2 years. We'll be having that again this year in Philadelphia in August 30th to September 1st. We provide leadership training for immunization program managers, and we also have our awards where we recognize excellence in program management, and also we have awards for innovation and excellence in immunization programmatic strategies. We have this year also taken over the CDC Immunization Champion Award, and this is an award that goes to one person, one champion in each state, in each jurisdiction, actually. So there are 8 territories and 6 large cities as well, who goes above and beyond to promote or foster immunization. And CDC has recognized these champions in the past. We're going to be doing that this year, so we're really excited about that. If you know of a champion in your state or you are one yourself, you can go to the state or your jurisdiction website will have information on how to nominate. And those nominations then come from the state to AIM, and we'll be giving out those champion awards in August. We have participated recently in a virtual roundtable with HHS Secretary Becerra on increasing routine vaccinations. This was a number of organizations that have worked for many years in immunization, getting together to talk about what we could do to increase routine vaccinations. And one of the things that we're doing as a result of that meeting is we've had established a work group to talk about pharmacies participating in VFC. And we have over 25 jurisdictions participating in our work group. And the goal is to identify challenges with enrolling pharmacies and working together to learn from each other on how to address those challenges, potentially getting more pharmacies to participate in the Vaccines for Children program. The other thing I wanted to highlight is a reminder recall program that we are doing. We are helping jurisdictions do reminder recall postcards for children and especially adolescents who are due for vaccines, and just sort of lifted the burden from the jurisdiction as we design and send the postcard out for them. And so we're doing this right now in 6 states, and we are also doing an evaluation. In Wyoming, 9% of children received their 4th dose of DTaP during the 12 weeks after the postcard mailing. So we're going to continue to expand this program and also to continue to evaluate and look at how we can improve it. Of course, some of the other things we're doing are just supporting the members with the pediatric expected rollout of COVID vaccine, potentially next week. And we've been also doing some supportive activities around health equity and vaccine confidence and various adult initiatives. Thank you.
Thank you, Claire. Is there a report from ERA?
I know Rebecca has a report, but she is facilitating, so she should be back shortly. Maybe we could just bump her to the end. Yeah,
sure. Thank you. American Pharmacists Association.
Hi, I'm Kelly Good. I'm the liaison from the American Pharmacists Association. Just a reminder that APHA is the largest pharmacist organization representing more than 60,000 members. Just want to remind that pharmacy providers are still going over and beyond to meet the healthcare needs of individuals and communities during COVID-19, but they continue to experience shortages of staff and resources, increased workload, and public demand, including funding restrictions that is causing concern. I thought you might be interested in this data from the CDC. There are 41,000 pharmacy vaccination sites, more than 250 million doses administered by pharmacy teams, 45% of all the COVID vaccine doses in the country, 48% of all COVID doses for those less than 18 years of age, 40% of doses in children 5 to 11, 70% of all boosters, and 43% of those doses have been administered in a minority group, including supporting activities of 45 million COVID-19 tests across 20,000 sites, and then expanding antiviral access at thousands of locations. A recent survey of 612 pharmacists found that the majority of pharmacists are prepared to administer COVID vaccine to children under 5. The association continues to support the pharmacists and their teams through engagement, including immunization awards, training, and information and resources. Thank you.
Thank you very much, Kelly. ASTO.
Hi, this is Meredith Allen. Nice to see you all. We also provided a written update, but I just wanted to highlight a few things for you quickly. Obviously, ASTO is really working to support our membership around the upcoming release of pediatric, the youngest of the children pediatric doses, hopefully in the next week. We've continued to support our health officials and their departments around providing vaccine-specific COVID-19 resources and really working on communication efforts to get positive vaccine messaging all the way into communities. Recently, we held the National COVID-19 Summit, which was a hybrid meeting, so both in person and virtual, similar to this one, something we're all getting used to and I think getting better at day by day, to convene our health officials, federal partners, and some partner organizations and subject matter experts, really looking at how to deal with the sustained management of COVID as we move forward. And then also the second day was looking backward a little bit and looking at some lessons learned. Some of the things that we highlighted in that session around vaccines, we're really looking at trying to figure out how to move into this next phase of immunization with COVID-19, really at pharmacies and also the medical home and how to help with reach those providers that we haven't reached already and strengthen that link to public health. We've also been co-leading the National Association Leadership Council with APHA, looking at the pharmacy public health interaction, and recently held a COVID-19 after action review. A report out should be coming from that in the next month or so. We had a great discussion about not only what worked well, but also things that we would like to change and fix for the future, but thinking through how we want to sustain and build upon the link between pharmacies and public health that's been really established throughout the COVID-19 response and the new partnership that we've had there. ASTA's also really taken this initiative around the development of what we're calling technical packages for our health officials, and we've recently completed one around adult immunizations, which is really looking at proven policies and actions that the health departments can take to advocate and improve immunization uptake in adult populations. And so that's something we've been looking to promote as well. Some of our cross-ASTA work, we've been working on supporting some cross-sector teams in developing and implementing immunization data sharing plans and action steps with ideas and the Office of the National Coordinator for Health Information Technology, or ONC. A lot of that work is out of our data and informatics work group. And then we also have a project where we are looking at reducing disparities in adult immunization programs across the country. And we've formed an advisory committee with several partner organizations to guide our project activities and have funded community action agencies to inform these specific action teams. The action teams then use evidence-based strategies and trusted messengers to really work around addressing and combating misinformation and conducting, some of them are conducting home-based or mobile clinic vaccinations. So thank you all for allowing me to provide the updates, and I look forward to hearing from the other organizations. Thanks.
Thank you, Meredith. Nacho.
Yes, hi, I'm John Douglas, liaison from NACHO. NACHO is the national organization representing local public health agencies across the U.S. We submitted an extensive written report, so I'll just offer a few quick highlights. NACHO remains in an incident management structure to respond to and assist local health departments with the COVID response, which is of course, really since the beginning of 21, had a heavy priority on vaccinations. NACHO does a lot of its immunization work through a very active immunization work group. That group has recently updated their policy statement on influenza vaccination for healthcare personnel and is also reviewing 2 additional policy statements, one on access to school-based data and a second one on immunization information systems. There are a number of other specific efforts NACHO has helping specific health, individual health departments across the country. Just calling out a few of those is one program equipping local health departments to address vaccine hesitancy. This has, of course, been fueled in recent years, rather, by the COVID experience. A second one is supporting local health departments to increase vaccine uptake, particularly in the area of COVID vaccines. A third one is partnering for vaccine equity. This is a growing program trying to address not only efforts to reduce racial and ethnic disparities in COVID, but all other vaccines as well. And then finally, echoing the work we did yesterday with the recommendations about vaccine confidence, are programs to equip local health departments to build COVID vaccine confidence, with demonstration projects going on in health departments across the country. Finally, not in the written report, but I would note that local public health agencies across the country have been involved in the monkeypox response, both in terms of providing awareness to selected populations within the community who may be at greater risk, contact tracing of those known to have been exposed, and as well as offering post-exposure prophylaxis recommendations. Thank you very much.
Thank you, John. I understand that we have a written report from the Public Health Agency of Canada, but no verbal report. All right, are there any other liaison representative updates? Any questions or comments from members of the committee here in the room or online? All right, not hearing any. Our next time interval is for public comment. I understand we do not have any public comments on the line. Is there any public comment here in the room? Seeing none, I want to thank all of you for your participation in our June 15th, 16th NVAC meeting. It's been a pleasure to see those of you that were here today. Nice to get back to hybrid, and hopefully we'll continue to do that going forward. I wish you all safe travels and look forward to seeing you all at our September meeting. Be well, and we will adjourn the meeting at this time.
Produced by the U.S. Department of Health and Human Services.